Is there a way to explain in a few words what a headache is and where it comes from? Like, how does all of a
Right.
sudden I have a headache?
Right. So, there's headaches is the actual umbrella term, and then within the headache realm, there's the different types, right? So the way that the main bodies of medicine, especially neurology, the International Classification of Headache Disorders, um, they like to categorize the main two camps, if you will, is the tension headaches and then migraines, and then in between you have all these other types of headaches. So the tension headaches are the headaches that most people get. Everybody in their lifetime will get at least one of those, which is, from dehydration, for example, or stress, where they just get this pressure in their head. It's like a vice grip. It's not too bad. They can still work through whatever they're doing, even with a headache. They don't have any nausea. They don't have any vomiting. They don't have to go to a dark room. And usually goes away with enough over-the-counter medications. That's a tension headache in a nutshell. There's other criteria to that. If you want to be more specific, you can, look at those diagnostic criteria. But migraine is sort of, think about a headache, but like a really, really bad headache where you get these symptoms I mentioned, the nausea, vomiting, light sensitivity, sound sensitivity, maybe smell sensitivity. Definitely, person, you ask them, what happens when you have the headache? Oh, I have to go to a dark room. I can't work anymore. That headache is like a 10 out of 10 in a scale of 0 to 10, as far as 10 being the worst pain. And sometimes the patient needs to go to the urgent care or even the ER because they may not take the medication they're supposed to in time. And then by the time they take something, the headache's already full blown, the migraine headache, and they can't stop it. So they have to go to the ER, they have to get some IVs or maybe an injection like Toradol, one of those drugs, and hopefully it stops it.
Whoa. So I'm assuming dehydration, food poisoning, and a bunch of other things, the symptoms could all be the same. It's like a bad
They
headache.
can, yeah. But migraineurs or people with migraines are also like a breed of their own. Like there's a lot of genetics to patients with migraines, right? So typically, a patient with migraine would have at least, typically, not always, but at least one family member with a history of migraines.
Got it.
And especially if their father has true migraines, then the kids are more likely to get migraines themselves.
As opposed to the mother.
Yeah.
Why is that?
There's, for some reason, I don't remember the specific details, but like there's some reason like that when the male person has migraines, then their offsprings are more likely to get migraines.
Wow, that's fascinating.
And there's other things that kind of go along with migraines, like people who have motion sickness, are also people who are more prone to migraines, or a couple other, pain states that like people with migraines just have a lower threshold for pain, for example.
Whoa.
So, there's a lot of other comorbidities, maybe a little bit of fibromyalgia, there's other type of pain disorders that people with migraines are more prone to. So,
That's so interesting. Headaches. It's a fascinating thing because they happen all the time.
right.